Hi, I'm going to talk today about trauma post-disaster and substance use disorders. This past year in Puerto Rico and in the mainland United States, Latinx individuals have been dealing with the aftermath of Hurricanes Irma and Maria, Hurricane Harvey, wildfires in California, tornadoes, and unexpected floods. These experiences can exacerbate past trauma histories such as domestic violence, gender-based violence, isolation, and anxiety. In Puerto Rico, the loss of property, damage to many homes, have been compounded by the grief of family members who had to leave the island due to lack of electricity for many months to a year, lack of employment, lack of resources to rebuild, especially in the rural areas. There is a loss of community and a great deal of uncertainty about the upcoming recovery process. In the mainland United States, there are a large number of Puerto Rican diaspora who hosted family members, sometimes bringing a number of them to the same home. That has changed the makeup and the routines of everyday life. Others in the United States have also been dealing with a large migration as well as with their own disasters mentioned earlier. All of this increases post-traumatic stress disorder and the use of alcohol and other drugs. Children are not immune to all these changes. They notice the loss and stress in their parents or family members, and however, they may not have the words to express their own sense of loss and sadness. In addition, in Puerto Rico, there had been the closing of more than 400 schools, and the children have been moved to new locations, bringing an additional sense of loss of community and loss of friends, loss of teachers, loss of the people they know. They have been adapted to those new neighborhoods. For those who migrated to the United States, they are adapting to a new language and new environments. So there is a dual process of change for those residing in the island and the diaspora in the mainland United States. Researcher Lisa Najavitz has studied the neurobiological changes in the brain with traumatic unexpected situations and the relationship with the use of alcohol and other drugs. She addresses the genetic predisposition to addiction as well as the numbing of pain through the use of substances. Providers working with the Latino community may have to be cautious when asking individuals about PTSD or post-traumatic stress disorder or trauma. They may ask an individual and the individual may say, "Oh, I'm doing okay, we are coping, estamos bregando, seguimos adelante." However, when talking more with those people, they suddenly start saying, "Well, I cannot sleep well. I have fear when I hear the rain. I think maybe another storm is going to come, another hurricane. I have nightmares, or I cannot be well driving. I'm concerned." So they start showing symptoms of trauma. They may also disclose uncertainty about the future. What's going to happen? My family is far away. What am I going to do? How are we going to communicate? How are we going to maintain our roots? It's hard when unexpected situations come. So providers may have to ask, what are your symptoms? Are you able to sleep? Do you feel tired or without energy? Are you drinking more to feel more relaxed? And slowly, the person may start disclosing the ways they're coping. Another unique situation is that providers themselves may have experienced the impact of the hurricane or other disasters and may have to stop and reflect in their own sense of loss and grief. There is a dual role when you are a survivor of a disaster and you are at the same time providing support and resources to others. So it's important to talk with a supervisor, a peer, or someone you know to receive support at the same time that you're supporting others. Survivors of domestic violence or sexual violence may also feel vulnerable, especially vulnerable during this time, adapting to new surroundings, or may be re-traumatized by partners who are having more stress, uncontrolled anger, and may return to abusive patterns of behavior, abusing their partners and feeling that they have to control something, so they start being too angry at home, and abuse may happen again. So you have to ask carefully if those situations are happening at home. There is also a great deal of stigma about mental health, trauma, and substance abuse, and Latinos may feel hesitant to talk about it. So as a Latina provider or Latino provider, or even if you are not a Latino, talk about those stigma and how that may be affecting your home and your children and the youth. The youth also may be going out in new environments and trying new things and trying alcohol or drugs to cope with their own stress. But there are resources available, and I'm going to tell you some of them. The first one is the National Sexual Violence Resource Center. You can Google that, and they have information for survivors of rape and domestic violence. There is also the National Child Trauma Network that provides information specifically for children and youth. And there is a new resource, is by the Substance Abuse Mental Health Administration, and it's called Mental Health Community Conversations. They have forums online where you can join a conversation with other people experiencing the same, or they may have meetings in your neighborhood that you can find out and go and attend and talk about these concerns. Finally, there is a brochure that is available for free. It's called Good Mental Health is Ageless. La salud mental no tiene edad. And it's a brief brochure, but it provides information about the impact of these symptoms and how to address mental health. There is another resource, the National Hispanic and Latino Mental Health Technology Transfer Center. They can provide you information and support, and you should not hesitate in contacting them. Adelante, we can recover.